Hi, everyone. Thank you all for joining us today. My name is Clarissa, the Grants Coordinator at the Society for Public Health Education. And I'd like to officially welcome you all to this live webinar addressing arthritis, an introduction to remote delivery of evidence-based interventions in partnership with the CDC and the Osteoarthritis Action Alliance. The Society for Public Health Education is an inclusive organization of health professionals, and we welcome your whole self. SOPHI's mission is supporting leaders in health education and promotion to advance health equity in communities across the globe. Members include health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and its numerous partnerships with other organizations. On behalf of SOPHI, we're pleased with the interest in today's webinar and are thankful that you have taken the time out of your day to participate. We would also like to acknowledge support from our partner organizations and agencies at the Osteoarthritis Action Alliance and the CDC. Before I introduce our two speakers for today, I would like to cover just a little bit of ground rules for this webinar. First, please know that all attendees are muted for the duration of today's webinar, and after hearing our presenters, we will have a quick question and answer session with the time remaining. Questions can be submitted at any time in the chat box, and for those dialing in through phone, you may dial 9 to raise your hand. The session has enabled automatic closed captioning. To add closed captioning, click on the CC button in your Zoom taskbar to enable subtitles. Please feel free to rename yourself and include your organization if you have not done so already. And you may, we encourage reactions at any time during the presentation. Now I am excited to introduce today's speakers. Serena Weisner serves as Director of Community Programs at the Osteoarthritis Action Alliance. Serena has 20 plus years of experience disseminating and implementing evidence-based programs in a variety of community settings. Additionally, Serena has experience in providing technical assistance to various community-based organizations. I would also like to introduce Julie Coleman. Julie is a CDC Public Health Associate, and Julie oversees the Arthritis Appropriate Evidence-Based Intervention approval process at the Osteoarthritis Action Alliance and has assisted SOPHI in the development of our toolkit to support the remote delivery of arthritis appropriate evidence-based interventions. Now it is my pleasure to pass over this presentation to both Julie and Serena.
Wonderful. Thank you, Clarissa. Thanks for having us here today. We're really excited to be able to join all of you in this session addressing arthritis. This is going to be the first in a series of webinars addressing programs for those with arthritis. And so we're really excited to be able to kick things off with this session today. Before I jump in, I did want to introduce you to the Osteoarthritis Action Alliance, or the OA Action Alliance, where Julie and I work. If you're not familiar with us, we are a coalition committed to elevating OA as a national health priority and promoting effective policy solutions to address individual and national toll of OA. In addition, the OA Action Alliance, along with the public health community, is working to ensure that people with OA or osteoarthritis have access, skills, and capacity to benefit from effective and proven interventions like the ones we'll be talking about today. I put a link to our website in the chat, so please check it out. Our website is full of resources for people with OA and those who serve people with OA. And also just a shameless plug, if you're interested in membership, it is free. So you can contact us afterwards if you're interested. Next slide. So today we're going to spend most of our time highlighting arthritis appropriate evidence-based interventions, or AAEBIs, and the tools and resources to help public health professionals adopt and implement those programs. But before we get into the meat of the session, however, I really want to take some time to lay a foundation for us. Some of you on the call may not be very familiar with arthritis and its impact on our nation and the toll that it can take. So I just want to take a minute to go through some of that first. Next slide. So while arthritis doesn't receive the level of funding or the notoriety of some of the other chronic conditions that you may be very familiar with, like heart disease or diabetes, it is certainly worth paying attention to and addressing from a public health perspective. Arthritis has a significant impact on quality of life for millions of Americans. So while arthritis won't kill a person, it can certainly make daily activities very challenging, painful, or fully impossible for them to accomplish. Next slide. So the word arthritis actually means joint inflammation. So it's kind of a general term for a condition that affects the joints, tissues around the joint, and other connective tissues. So the specific symptoms can vary depending on the type of arthritis, but it usually includes pain or stiffness in a joint. So as you can see here, there are over 100 different types of arthritis. Osteoarthritis, or OA, is the most common form of arthritis, affecting over 32 million US adults. It occurs most frequently in hands, hips, and knees. So those joints that are really very important to the things that we do every day, from typing on our keyboard to walking our dog or unloading groceries or walking upstairs. All of those things can be impacted. With OA, it's the cartilage within the joint that begins to break down. And then once that cartilage is broken down, the actual underlying structure of the bone actually starts to change. And that is what begins to cause the pain and the stiffness and the inflammation. Next slide. So CDC estimates that about 1 in 4 US adults have some form of arthritis. So one of those over 100 types of arthritis. And that figure is actually projected to increase to 78 million in the next couple decades. And people with arthritis often experience limitations. As I mentioned, those important joints can be impacted and limit what you can do in your day. So working and playing and activities of daily living like cooking and bathing are impacted by arthritis. Unfortunately, the number has increased 20% just in the last couple decades. So that's a pretty significant impact on our society as a whole and individuals as well. It's important to note that arthritis doesn't just impact older adults. I think that's a common misnomer. More than half of the people with arthritis are in the age range of 18 to 64. So that's kind of a range we call working age adults. So those people that are generally still going to an office or maybe working in a factory or doing some sort of work generally before retirement. So it's not just an older person's disease. One thing we do want to note, though, and something that we are going to begin doing more on at the OA Action Alliance, is the connection of arthritis and falls and fall-related injuries. It can contribute to an increase in the likelihood of falling, as well as those falls resulting in injury. And of course, lastly, I do want to mention that arthritis is extremely costly, both in personal losses like lost wages due to not being able to work, but also to our healthcare system. It's the second most costly health condition treated in US hospitals. So definitely something that deserves our attention from a public health perspective. Next slide. And as I mentioned, the prevalence of arthritis is increasing. And it's not surprising given our aging population, our generally sedentary lifestyle, the increase of obesity. These are all contributors to the development and worsening of arthritis and arthritis symptoms. Another point I wanted to mention is comorbidities. So we have seen that arthritis is actually more common among those people with other chronic conditions. So for example, 47% of people with diabetes also have arthritis. 49% of people with heart disease also have arthritis. So what we end up seeing is a vicious cycle where people have pain in their joints, so they think that they need to rest those joints. They become inactive. They end up gaining weight, which then exacerbates diabetes and heart disease symptoms. And then they have worsening symptoms, they gain more weight, and they become isolated. And it is just a cycle that can spiral really quickly. So what we want to do is we want to really educate people that even though you have arthritis, that doesn't mean that you need to stay sedentary, that you have to, quote unquote, rest your joints. That is actually the opposite of what you need to do. And we'll address that some today with these programs we're going to talk about. Next slide. So there are a number of pharmacological and non-pharmacological strategies for managing the symptoms associated with arthritis. This diagram here shows 4 key interventions that are in the kind of non-pharmacological area that are recommended by the National Public Health Agenda for Osteoarthritis. There was a 2020 update of that. So even though these here are called out for OA in the OA agenda, they are strategies that align with those recommendations for most other types of arthritis as well. So the 2 we're going to focus on here today with our conversation around AAEBIs is self-management education and physical activity programming. So self-management education workshops are usually kind of interactive, community-based workshops that teach participants the skills they need to be successful managers of their arthritis symptoms and other chronic conditions. Physical activity can basically include any joint-friendly physical activity that puts less stress and strain on joints and reduces the risk of injury on those joints. Today, we're going to talk about kind of community-based programs that support that type of physical activity for people with arthritis. Next slide. And now I'm going to go ahead and turn it over to Julie to talk more in depth about AAEBIs.
Great, thank you, Serena. So as Serena mentioned, self-management education and physical activity are both key elements of addressing osteoarthritis and arthritis, and they've been proven to be effective and useful for those suffering from it. And as that is so, we want to introduce you to the ways that those 2 elements are able to be applied and practiced in real time by individuals, which brings us to AAEBIs, or arthritis-appropriate evidence-based interventions. So if we break that down, evidence-based interventions are characterized as being so because they have proven to have an positive impact on our participants, and that is determined through rigorous research and testing. And specifically for our use, we are concerned with arthritis-appropriate evidence-based interventions. And with that, arthritis-appropriate very simply means that these interventions have a positive impact on arthritis symptoms. And in order to establish that these things are true, we have conducted an annual review process. And if you could go to the next slide, talk a little about that. So the Osteoarthritis Action Alliance was funded by the CDC to conduct this review process in 2020, and the first batch of approved AAEBIs came out in 2021. This review process is conducted annually, so to date we have had 2 full years of the AAEBI approval process under our belt, and we have now over 20 approved programs. The review process is importantly made up of 2 large components: an initial screening process and the first round of vetting, which is done internally by the OA Action Alliance, which simply checks a list of baseline criteria that has been established specifically for this process and ensures that the programs have an outline of what's necessary. And then if they pass this check, they're able to be sent to be evaluated by a national group of reviewers with extensive expertise in arthritis research, AEBIs, program evaluation, and program implementation. This group then determines which programs meet the level of criteria we have established, and we are able to announce that year's list of AEBIs. And so the reason that we carry out this process every year is to identify new community-based programs that meet the established criteria, so we're able to expand the menu of offered programming. And continuing to expand that menu is important because we want to be able to reach as many different populations as we can. And with that, make sure that the offering we have spans a wide range of ability and interest. We also want to make sure that we're able to capture many different risk factors and symptoms of arthritis that can go beyond aging, mobility, and pain. For example, something that can be overlooked sometimes with diseases such as this, or social or psychological effects. And so we want to make sure that we're addressing all of the risk factors that might be encompassed by a disease such as this. And finally, we want to make sure that with our menu of AEBIs, as Serena mentioned earlier, we're able to address those comorbid conditions. Obviously, these programs are primarily recruited and reviewed for arthritis-related symptoms, but as we know very well in health, there is nothing that happens in a vacuum. And specifically with arthritis, we often see individuals suffering from chronic conditions like obesity, pain and fatigue, or depression. And something that we can really proudly say with our menu is that we are able to address many of those comorbid conditions along with arthritis. But of course, there's always room to improve, and we want to make sure that we're just building upon that progress. Next slide, please. And so now I'll just give you a brief look into our baseline criteria for AEBIs, just so that you have a good grasp of what it looks like to apply, but also so that you're aware of the standards we hold these programs to in order to be able to be considered as an AEBI. So the first thing we ask for is that the program research must be published in a peer-reviewed journal article, and we give the opportunity for the program developers to submit up to 3 publications. The program's pilot study or studies must include 75 or more subjects in the treatment group. The research needs to include a pre- and post-test at least 3 months post-measurement or more rigorous design. The program research must measure at least 2 arthritis-relevant outcomes, and the research must have statistically significant changes in at least 2 arthritis-relevant outcomes. Next slide, please. Thank you. The program research must include people with arthritis as well, and there should be a consistency of evidence with the study results, particularly if there was more than 1 article submitted. The studies documenting evidence must be judged to have reasonable rigor. And finally, there must be reasonable infrastructure in place to support the program for dissemination. And this is the availability of training manuals, dissemination materials, and supports and guidelines for the intervention. So basically whatever an organization might need to be able to implement the program. And as I mentioned before, this is considered our initial screening criteria. And then once a program gets past this level, they're turned over to that expert panel of reviewers to do a very thorough review. And if I could have the next slide. Thank you. So we made it to the list of AEBIs for the 2022 calendar year. And as you can see, we have over 20 programs offered, which capture a large audience. And just to quickly name a few of the benefits of some of the approved programs, they allow participants to be able to learn how to overcome barriers and set goals for health. They create greater awareness of one's body and reduce arthritis-related joint pain and stiffness, and they can help to establish longer-term healthy lifestyle behaviors. And as I said before, there's a wide range of offering. There are walking and exercise programs, one-on-one sessions or group sessions, toolkits or book-based programs, and so many ways for individuals to engage in these healthy habits. And the other great thing about many of the AEBIs is that not only do they address many different arthritis-related needs, but they come in a wide variety of modality, including virtual or remote formats. And so if I could go to the next slide. So everything that you see bolded here is able to be offered in a remote format. And this is something that we're extremely excited about because it means that these programs are able to capture an even larger audience and that they're able to be utilized by people with any level of comfort and ability. One lesson that I think we all learned during COVID was just how adaptable we needed to be. And in the era of technology and shifting modality, these programs were thankfully able to jump ahead of this and take advantage of the many ways that we are able to connect. All of that said, establishing these programs in a different format is still relatively novel, and we wanted to get the word out about how health professionals, can best utilize these tools in our communities, which is why our team created the SOPI Toolkit. And I'll turn it back over to Serena now to talk a little bit about that.
Great. Next slide, please. Okay, so about a year ago, we at the OA Action Alliance partnered with SOPI to create a toolkit that was really aimed at introducing healthcare professionals to AAEBIs with a focus on those that could be delivered remotely. So that's why Julie was highlighting that last slide, showing those that can be delivered remotely. So we know that while many people are beginning to transition their public health education programming back to in-person, we still know that the delivery of remote programs or delivery of programs remotely is still a need in our communities. There are a number of people who are unable to attend programs that occur in a kind of in-person community-based setting. There are people who have health issues, they don't have transportation, they may have caregiving duties, they may live in rural settings where they just don't have access to programs in community settings. So to be able to serve those people with effective evidence-based programs is really important. In addition, let's face it, there are times in our country, like the first 1 to 2 years of the COVID pandemic, when in-person programs just weren't an option. But these programs that were able to be delivered remotely could continue on, even in that period where we couldn't be together in person. We could provide that public health and health education support remotely. So when SOPI approached us about putting together this toolkit, we thought that, yeah, even though the pandemic kind of seems to be on the downside, this is really an important tool for people moving forward. And I think continuing on in this remote fashion in some way or another is going to be important for our public health efforts. So we have, as Julie mentioned, we highlighted those programs that are available in remote format. And we really did a deep dive on the program characteristics. We came up with a table that shares the different kind of high-level key characteristics of the physical activity programs, as well as the self-management programs, so that we could hopefully give those of you who are interested in adopting and implementing these programs a really clear snapshot of what these programs entail, who they address, where they can be held, the types of training that are required for these programs, so that you could quickly see, okay, this physical activity program would fit really well with the structure of my organization and the population that I'm trying to reach, and maybe the resources that I have able to do this type of programming. So we wanted to make sure that we highlighted those programs, we identified those key components of those programs, and then we provided resources to kind of lead people through the adoption and implementation of that program. So for each program in the toolkit, we have a planning section, an implementation section, data collection section, and a sustainability section. And within each of those sections are tools and resources to support that activity within the process of offering an AAEBI. We also have universal tools and additional resources included as well that kind of aren't program specific, but can be used as part of the process of offering one of the programs. And then there are fact sheets to enhance the understanding of evidence-based programming around arthritis. Next slide. So right here, I was going to just kind of share some screenshots of the toolkit, but because we have time, I'd like to actually show the toolkit kind of live and in action. And this is always a little nerve-wracking for me because I don't want to lose it, but oops, hang on a second, that's not what I meant. I don't want to lose connectivity to everyone, but I'm feeling confident today, so. All right, so here you can see, and we will share this link to this toolkit with everyone today. This toolkit is housed in Sophie's learning management system called CORE. And correct me if I'm wrong, Clarissa, this is free for anyone to join, correct? Yes, so it's free. Anyone can join the learning management system, have access to this toolkit. And I think that the way it is set up is really, really intuitive. I think Sophie did a great job of taking the information that can be a little bit overwhelming and putting it into an actionable tool. So if you kind of scroll down, you can see that we have this getting started section. And this is kind of contains some of the information that I covered during the beginning of this webinar. We know that making the case to leadership and to collaborators, partners across the table, across different industries is going to be important because, as I mentioned in the beginning of the session, diabetes and heart disease, they are kind of the squeaky wheels in the world of chronic conditions. And we really need to elevate the data that supports addressing arthritis. So this section of the toolkit, if you click on that, will give you links to a bunch of information and reasoning why you should go ahead and address arthritis. So each of these, and you'll see as we click through the toolkit, each of these is kind of a drop down, I think they call this a waterfall menu, where you click on it and it waterfalls out a bunch of other amazing tools. So just really encourage you to check that out. What I provided today is really just the tip of the iceberg. There's so much more information and data around this. So I'm going to go ahead and go back to the beginning. And so then you can see that, as Julie mentioned, we have kind of these two categories of AAEBIs, the physical activity programs and the self-management programs. So we'll just go ahead and we'll click on physical activity so you can see what this looks like, get an idea. Okay, so we have here each of those programs that are available in the remote format. And under each program, as I mentioned, there are 4 different sections. So program planning, program implementation, data collection, and sustainability. Again, there's these waterfalls that open up when you click on them and close when you click on them again. So we have these same sections for each of those physical activity programs: enhanced fitness, fit and strong at home, etc. And we'll go back to, let's look at self-management programs. Hopefully I'm not making anyone too dizzy. So again, same same idea. There are the different programs and the different subcategories underneath. And then if you go back, as I mentioned, we've got the universal tools. So these are the tools that are kind of helpful for any of these programs. And again, we have them organized under those same kind of big umbrella headings. Program planning. So a couple of examples here, like this remote delivery of physical activity programs for older adults by NRPA. Program implementation, resources for engaging older adults. So you can see that these resources are not specific to any program, but they're certainly important tools and resources as you're coming up with your plan to adopt and implement an AAEBI. And then additional resources. These are tools that, again, are just kind of information around kind of bigger picture things, not so program specific. So like the Healthy People 2020 arthritis page, that's a pretty big resource that may fit into some piece of your entire strategy addressing arthritis for your organization, but may not be program specific. So I'm going to go ahead and stop sharing there. And Clarissa, if you want to go back to the slides. And since I've gone through those, I'm just going to go to the next one. So here we have, and you'll see once you have access to these slides, and I think Clarissa, are these going to be on your website? Okay, so these are all live hyperlinks to these different pages. So obviously the SOFI toolkit. We have a link to our AAEBI page on the OA Action Alliance website. So that page not only describes the programs that are currently AAEBIs, but it also links to the process of the review process and the application, which I think we're almost open for the next round of applicants coming up here soon. So if you know of a program that has been proven to have a positive impact on arthritis symptoms and kind of ticks off all those boxes that Julie went through, we highly encourage you to either submit it if it's your program or contact the program owner and have them submit it for review. We really would love to see this list just continue to grow. As you might have noticed, we don't have any programs that currently address weight management. So healthy eating and weight management is definitely something we would love to see more evidence-based programs available in that area. And then we also wanted to highlight our friends and colleagues at the National Association of Chronic Disease Directors. They just came out with a CME that's free, and it basically is testing your knowledge of evidence-based programming around arthritis, or arthritis lifestyle management programs, I think is what they call it. So I think that's it for us. Next slide. So here's our contact information, and again, that OA Action Alliance website. We are open now to any questions that might have come in or discussion.
Yes, thank you so much, Serena and Julie. And we did have a question come into the chat from Angie. Are all of these programs free for patients? And I believe she was talking about the programs you had on one of the slides with the list of self-management and physical activity programs.
Yeah, that's a good question. And really that comes down to who the host organization is. Oftentimes an organization like an area agency on aging or Parks and Rec, they will offer programs at no cost for patients. Generally, though, the programs, if you are an organization that wants to adopt and offer the program, there are generally fees associated with becoming a licensed organization to offer that program. And then, it's up to your sustainability structure and management to figure out whether you can offer it for free to patients.
And just to piggyback off of what Serena mentioned, on the AAEBI website for the entire list of AAEBIs, we have cross-sectional charts where you can see a breakdown of each intervention and what the associated costs are and how, what kind of audiences you'll be able to interact with. So if you're interested in that, there is a good recounting of it all on that AAEBI website in the chat.
Mm-hmm.
Yes, and I also want to mention with the link I put in the chat, on the sidebar, there are tables where it gives the program details as well as the program cost. So they're titled Table 1, Table 2, and Table 3, where it goes over self-management programs, physical activity programs, and just them combined. So make sure you all take a look at that. And we did have another question. What are some first steps that community organizations can take to get started in offering a program?
Mm-hmm. Yeah, I would say, so the first question, or the first thing to do, is definitely check out the toolkit because that toolkit really can lead you through the process. Everything from identifying kind of the needs assessment of your community to finding those people to collaborate with, and then figuring out which program is going to kind of fit the needs of your partners as well as your community. So I would start with that and start with probably just identifying partners is probably your first thing, because I don't think, as Julie mentioned, none of these programs is offered, in a vacuum. Public health doesn't exist in a vacuum. There are so many other variables. And so having a strong partnership is going to create that foundation for success.
Yes, absolutely. I agree. I cannot express enough how important partnerships are. And that is a good segue into our next question, or how can organizations engage with community partners, and who would be a good partner to collaborate on with this?
Yeah, so as Serena sort of mentioned, the arthritis community, we have a lot of collaboration in the arthritis community. There are area agencies on aging, community organizations, nonprofit organizations, even individual healthcare practitioners that might be interested in helping to offer these programs. It really just takes asking and deciding who in your community might be good to partner with. And there's no harm in sort of reaching out and saying, is this a possibility, right? It really does sort of make the collaboration possibilities endless. The other thing that's important to note, though, when you are looking to create a partnership or engage someone in your process, it's important to think about bringing them into those first conversations and making sure you are reaching the audience that they are able to connect with, and making sure that whatever AEBI or program you're looking to offer is going to be conducive to the environment that you're working in. So just making sure that it's transparent and that you're able to have a nice line of communication with those partners is the most important thing, I would think.
Mm-hmm.
Absolutely.
Sorry.
Go ahead.
I was just going to provide an example of something that we didn't necessarily think about early on, but collaborating with employers that have a high population of employees who do repetitive motions. So a lot of like factory workers and those types of people have a lot of incidents of arthritis. And we have heard of a really successful collaboration with a poultry processing plant, because those people are doing repetitive motions over and over every day. And their hands and their wrists and their elbows are really struggling. And so that's the type of employer who might really benefit because they could decrease absenteeism or presenteeism with their employees due to arthritis.
Yes, thank you so much. And our final question, how can an organization decide which programs are the best fit for them to offer?
Yeah, and I think this kind of is like everything we've been saying is find your partners first, because those people are going to create that foundation. So once you and your partners have determined who your target audience is going to be, then you can really do that needs assessment and figure out, okay, well, we already have 3 physical activity programs going right now. Maybe what we need is a self-management program. And if a self-management program is what is needed, then is an in-person or a remote version going to be best? So having those strong partners at the table to begin with is really going to be kind of where it's at from the get-go, because then you're going to be able to clearly identify your audience and your program that fits that audience.
Absolutely. And then I see one final question in the chat from Adam. Have you been able to accumulate operation costs that organizations will need to cover to offer these interventions, and how the table includes licensing and participant costs, but doesn't necessarily account for things like staff salary, benefits, etc.
Mm-hmm.
It's a great point.
It is, absolutely. And we really relied heavily on the program administrators for that information. And, to be honest, it varies so widely across organizations, because a lot of organizations are driven by volunteers. So they don't have to pay staff to actually lead a program or a workshop. And so that cost is going to be much less than an organization that maybe has all health educators or physical therapists on staff that need to be paid for each of the sessions of a workshop or a program. So we have given kind of the high level information that has been given to us by each of the program administrators. And then further deep dives are just going to have to be done one program at a time.
Yes. All right. Thank you, everyone, for those wonderful questions. And thank you, Serena and Julie, for answering them.
Yeah,
Thanks for having us.
Again, so that brings the presentation to a conclusion. And again, I want to thank you all for this wonderful presentation, and to all of the participants. And we do have another webinar lined up for February 14th at 1 p.m. Another live webinar on addressing sustainability, walk with ease. And our speaker will be Nick Turkis from the Arthritis Foundation, and he will be speaking about program sustainability and speak a lot about his current program titled Walk with Ease. And the registration link is posted in the chat. So thank you, Jade, and we encourage you all to attend. And before I end the session, I just want to let you all know that our SOFI 2023 annual conference is now open for registration, and we will be in person this year in Atlanta, Georgia, from March 21st to March 24th, and we encourage you to attend, and you can visit sofi.org for additional information. And we value your feedback and ask you to please complete the webinar evaluation that is posted in the chat. Your evaluation of this webinar will assist us in planning for future webinars and make any necessary improvements. And please know that today's webinar will be archived on SOFI's eLearn website and uploaded on SOFI's free YouTube arthritis playlist. And on behalf of SOFI, we thank our presenters and all of our participants today. Once again, today's webinar was recorded and will be archived within 48 hours on SOFI's eLearn and Core website, as well as our YouTube page. Thank you, and this ends our webinar for today.
Thank you, everybody.
Thank you.
Have a great day.